Today we're talking about childhood infections. We've chosen chickenpox, the signs, symptoms, and prevention. The first one is going to be the signs and symptoms. Anyone who hasn't had chickenpox or gotten the vaccine can still get the disease, the virus. Chickenpox illness usually does last around 5 to 7 days. The classic symptom is a rash that turns into an itchy, fluid-filled blister and eventually turns into scabs. The other signs and symptoms, as we get to the next slide here, is fever, tiredness, loss of appetite, headache, and children usually miss 5 to 6 days of school or childcare due to this virus. What is chickenpox and what is the main cause? Chickenpox is a virus infection. Before chickenpox vaccine became routine in the US and now Canada, chickenpox was a common childhood illness caused by the chickenpox virus, which was more formally known as the varicella zoster virus, VZV. In unimmunized populations, most people contract chickenpox by the age of 15, and the majority of children are between ages 5 and 9, but it can be contracted at no matter what age. So what is the duration? We talked a bit about it being 5 to 7 days, but the incubation period in this is about 14 to 21 days after contact with the virus. The spots do rapidly develop into blisters. Rashes usually develop and start on the head and the trunk and spreads to the arms, legs, eyelids, mouth, and sometimes the throat. The rash typically is very itchy and develops in groups of new blisters, and even as old blisters dry up, new ones will surface. Over the 5 to 7 days, all of the blisters do dry up, become crusted, and the illness is technically over. So some of if you have been vaccinated, some of the people who have been vaccinated against the chickenpox still get the disease. However, some of the symptoms are usually milder with fewer spots or blisters and mild or no fever at all. Though uncommon, some vaccinated people who get the chickenpox will develop an illness as serious as chickenpox. And Karmen will talk to you about the risk factors.
So the risk factors associated with chickenpox are not having immunity against chickenpox by infection or vaccination. So obviously anyone who gets the vaccination is less likely to contract chickenpox. Exposure to a person with chickenpox or the adult advanced version of chickenpox, which is shingles, would also increase your chances of getting it. The way that chickenpox is spread, how are chickenpox spread? It's very highly contagious, so it's recommended that if children show symptoms of chickenpox that they stay at home just for the safety of the other children, as well as their own well-being. Winter and spring are the most common times of the year for chickenpox to occur. It's easily passed between members of families and school classmates through airborne particles, as I was saying, droplets and exhaled air and fluid from blisters, kind of gross. It also can be transmitted indirectly by contact with articles of clothing and other items exposed to fresh fluid from open sores. So what is the contagious period for chickenpox? Varicella virus remains dormant after the acute chickenpox syndrome. Parents have sometimes brought well children to the home of a child with chickenpox for a chickenpox party as a way for them to acquire lifelong protection early. There's some debate about whether this is a good idea or not. This practice may make sense in very resource-poor areas of the world, but it carries the risk of complications of varicella and the long-term risk of shingles later on, which is very painful for adults and has other potential serious complications especially for senior citizens. What are the Ottawa public health regulations regarding chickenpox, you might ask? Well, as of September 2014, children who are born in 2010 or later must be immunized against varicella in order to attend school. Immunization record must be provided and registered with the local health unit. The varicella vaccine is available from family doctors and walk-in clinics for free, and that vaccination is funded by the province. Doctors will give written record that you have gotten the immunization whenever an immunization has taken place, and it is your responsibility to keep hold of this information. There's many discussions about whether there should be a larger scale resource database for healthcare professionals to just access whether or not you've got immunizations. Immunization record requirements, according to the written records of immunization for chickenpox, are needed when you or your child is starting your first day of kindergarten. If you are transferring, or your child is transferring to a new school in another area, if your child or yourself is going to a summer camp, if you're starting university or college, depending on the program, if you're living in residence at university or college, if you're going to work in healthcare or childcare, or any area with vulnerable population, really. If you're traveling to certain countries where chickenpox is common, then you would also need the immunization. So what are the Ottawa public health requirements regarding chickenpox? Anyone ill with chickenpox is contagious and should be cared for at home. In the event of an outbreak, any children without the immunization must stay at home. There is a chickenpox weekly reporting form to report anyone who has the disease. Therefore, the city can get a realistic number of how many people are getting the disease. Chickenpox has decreased dramatically in regularity since the implementation of the vaccine, luckily, as you would expect. All right, and I'll give it over to Marcie for the next part.
Awesome. Okay. So what are the early learning and child care centers, or what the early learning and child care centers can do to prevent chickenpox? Many schools and child care centers have policies and require children with chickenpox to stay home for 5 days after the rash appears. Policies that require your child to stay home for a period of time don't work because by the time it's known that the child has chickenpox, it has already been passed on to other children. If your child is too sick to take part in regular activities, or if they have a fever, they should stay home. Sorry.
It's okay.
Okay. If a child has high fever in most early learning centers, the staff will make the decision if the child stays at the center or needs to go home, depending on the center's policies, etc. If they are not able to stay home, then the staff will inform the child's parents, and the parents is then asked to come and take their child home. Also, parents will be asked to inform the early learning center if their child does not in fact have a communicable disease, so that the early learning center can be inform other parents. Alright, and I'll let Fiona go ahead.
So what should a parent-caregiver do if the child gets chickenpox? So first, they should keep the child at home so they don't infect other children and can rest. And also discourage the child from scratching the sores, and trim the fingernails and put mittens on the child at night. So to help the child relieve itchiness, fever, and discomfort, they can apply cool, wet compresses to the sores, place the child in a bath of cool or room temperature water every 3 to 4 hours for the first few days. Oatmeal bath products are also very helpful, and they can gently pat the body dry after bathing. Also applying calamine lotion to itchy areas, not on the face, can help relieve the itchiness. And you can offer the child cool, soft, and bland food so as not to irritate the sores in the mouth. Some precautions to take. So you should avoid giving the child orange juice or acidic salty foods. And also consult a doctor to see if antibiotics might be needed, since they can become inflamed or infected. You should also ask the doctor about pain-relieving creams and over-the-counter medicine for itching, and give the child acetaminophen to relieve pain. You should not give the child aspirin, and you should call your doctor if concerned about severe symptoms such as severe cough or trouble breathing, a fever above 102 Fahrenheit, severe headache, difficulty walking, or disorientation. Thank you.